Shortly after 9/11, we were approached by the federal government to help out in terrorism preparedness and emergency response. And so this work, in some ways, is a combination of all the research and work that we've done in healthcare over the years and the work that we've done in the emergency preparedness field as well. And as Barry said, we embed with leaders during crises. We learn and understand what they've done, what worked and what didn't work. And out of all this work, from healthcare to homeland security, this is a combination of best practices for leaders and also providing people with warnings of where leaders can get themselves into trouble and what they can do to get themselves out of trouble, because we live in a very complex world. And it's not a command and control scenario, whether we're talking about health or we're talking about an emergency response. Our research on crisis leadership included a very intense study of the leaders of the Boston Marathon, which occurred here in Boston in April 2013. And one of the questions that we always ask when we're analyzing a complex event is, who is in charge? And as we went through our many interviews and focus groups, including leaders of emergency and trauma care and hospitals, law enforcement officials, elected officials, one of the aha moments for us was that in that particular event, no one individual or no one agency was really in charge of the whole event. That was perplexing to us because in most crises, someone was in charge. And as we were trying to figure out that puzzle, one day Eric walked in the office and he said, swarm intelligence. And we got fascinated with this relatively new science that helps to understand how bees and termites and ants interact with one another and then accomplish extraordinary feats. So we went through all of our interviews and we asked, well, if there were rules and principles that guided leaders here in Boston, what were they? Just as there are rules and principles that guide these termites and ants. And we came up with the 5 rules and principles of swarm intelligence, and they are unity of effort. In the Boston Marathon, it was save lives. The second one was generosity of spirit and action, and that often was interpreted as, what do you got, what do you need? People really willing to help one another. The third one was everybody stayed in their lanes and helped others succeed in their lanes. This was a situation where there were many rivalries and competitions among different hospitals, between different law enforcement agencies, and they worked together. The fourth rule was no ego, no blame. Nobody took credit for everything, and nobody was pointing fingers at others that they didn't do it right. And the fifth one was working on a foundation of really good relationships. This is a community of people who knew one another, who cared for one another, and who worked together in a way that is very rare and very uncommon. And among the thinking and research that we're doing right now is how we might be able to apply these rules and principles of swarm intelligence to the work, the complex work of healthcare, when you've got many, many different constituencies trying to come together, working together. And if you think of a health system or a hospital or medical center in a much larger community, the question is, how do you take what's learned from swarm intelligence and apply it to complex problems facing healthcare?